Hi, this is Jen, and I'm teaching on emotion recognition among early intervention with ASD. The purpose of teaching emotion recognition to young children with autism is to address the core deficits that impact their daily life in relationship to family, peers, teachers, community members, specifically around reciprocal social interactions and communication. Emotion recognition is a fundamental building block. It impacts emotional awareness, self-regulation, and social interactions, especially supporting the formation of friendships. The difficulty of teaching emotions is that, as Skinner tells us, emotions are private events, internal states that often represent unique experiences. Also, emotions range from very basic to increasingly complex very quickly. Also, processing social information requires the timely interpretation of multiple verbal and nonverbal stimuli. For example, facial expressions. Individuals who are autistic tend to watch the mouth instead of reading the eyes. And other components that would need to be taught would be tone and volume of voice, body language and posture, gestures, and contextual situational. Emotion recognition may also be a skill that is resistant to change because it underlines the core deficits of ASD, that's reciprocal social interaction and communication deficits. So what is developmentally appropriate? And we can use this as a guide. 4-month-old infants can discriminate between expressions of anger, fear, sadness, happiness, and surprise. 8 to 10-month-olds start using emotional expressions for social referencing. And this means that it is an appropriate goal for us as practitioners to have for young children identified with ASD who lack this ability. In teaching emotional recognition, what is the role of language? And this is a little bit of a chicken and an egg question. What comes first? Is language a developmental prerequisite for more advanced social and emotional skills like perspective taking? Or do theory of mind skills facilitate language? If we use typical development as a guide, then language shapes cognitive ability. And yet it isn't the only factor. So within EI, it might seem to us that perspective taking or theory of mind is still a long ways away. And in reality, as early as elementary school, children are expected to answer the question, what do you think will happen next in the story? And the child with ASD, even with language skills, would often sound like a broken record. I don't know. And if the teacher were to ask he or she to take a guess, child with ASD might respond, I can't. I'm not that person. And within EI, we have the ability to address this deficit at an early age and build towards more advanced skills and proficiency. So names that you would see frequently in literature in early research of emotion recognition are Hobson, in which he took 3 groups, an ASD group, a typical developing group, and a non-ASD group with intellectual disability. And the task was to match drawn and photographed pictures of basic emotions to videotapes showing gestures and vocalizations within context. The results were that the ASD group showed significant deficits in matching, even though they were similarly capable of matching non-facial objects compared to control groups. Barron, Cohen, Leslie, and Frith used the famous Sally Ann test, the false belief test, to show that typically developing children and non-ASD children with Down syndrome are able to answer correctly, where will Sally look for her marble? And the ASD group revealed a cognitive deficit without regard to IQ, and this helped explain their lack of pretend play and social impairment. So along with teaching joint attention and play skills, teaching basic emotion recognition skills fits within an EI program. These are complementary skills. Within the last 30 years, there has been considerable discrepancy among studies in emotion recognition. So some studies showed that ASD population had deficits and others did not find deficits. Sometimes those deficits that were found only existed in negative state emotions like fear and sadness. Sometimes those deficits only existed in complex emotions, but not basic emotions. And there's speculation that the differences were due to variations in IQ, language ability, or the task, such as emotion matching versus tacting. So Yolzarek and Hamilton in 2013 conducted a meta-analysis in which they included 48 papers from 1989 through 2011 with a total of more than 932 participants, ranging in IQ from 60 to 130 and age from 6 to 41, and concluded that those with ASD do have deficits in emotion recognition without significant effects for IQ, age, or task, that those deficits were not particular to a subpopulation, they existed throughout the lifespan, and they were consistent in sadness, anger, surprise, fear, and disgust. There was difficulty identifying happiness that was borderline. There was heterogeneity of results, large differences between individuals. And that fits with our own understanding in EI that skills deficits exist and they are unique to the individual. In their meta-analysis, Yolzarek and Hamilton, 2013, found that some of the studies have methodological weaknesses that we've learned about and seen before, such as small sample sizes, a need to publish all the data, a need to incorporate technology like functional MRIs, and the need to expand the recognition of emotion to include dynamic situations. So while deficits in emotion recognition might seem clear to the practitioner, the research is recent. So Friedensen-Hayo in 2016 extended this research to include children with ASD in other cultures, specifically Israel, Britain, and Sweden, to see if they also exhibited deficits in emotion recognition. And she found that the autism group showed basic and complex emotion recognition deficits during visual stimuli and complex emotion recognition deficits during the auditory tasks. There was a lack of cultural differences, possibly due to the young age of the children, and it supported an understanding that these deficits are specific to autism and there is a need for intervention. But similar to these other studies, limitations are small sample size, gender, and there were no non-Western cultures. So, having established a consensus among the researchers that emotion recognition deficits exist in autism, you might have noticed the participants' ages, none in EI, birth to 3 years, This has implications for finding research on teaching emotion recognition skills. The literature skews to school-age populations, which means we as EI practitioners have to extrapolate from what exists. And while that is an imperfect fit, it does tell us that teaching emotion recognition can be successful. Golan et al. 2010 created a high-quality animated cartoon called The Transporters. And this was an effort to use computer-based intervention to teach emotion recognition skills. It's reminiscent of Thomas the Tank Engine. It's a cartoon. There were 20 children, ages 4 to 7. There was a control group of waiting list children and another control group of typically developing children. The intervention group watched daily for 4 weeks at least 3 5-minute animated DVD episodes from this series, The Transporters, who are 8 characters that are vehicles that have real life faces of actors with different ethnicities, sexes, and ages. The episodes can be watched in any order. They focus on an emotion or mental state, basic and more complex. There's a narrator that allows the children to focus on the facial expressions as a whole. And these 3 groups were tested twice, once before the intervention and 4 weeks later. The results were that the intervention group was able to make significant improvement in defining emotion vocabulary and matching familiar and new situations from the episodes to facial expressions of the characters, to new expressions of the characters, and with new expressions of actors, to the extent that the intervention group scores were indistinguishable from the typical developing group. And the implications is that young children, ages 4 to 7 with autism, are capable of learning emotion recognition skills in a short time, and that they were motivated by visual stimuli that appealed to their preference for predictability in systems. Limitations are the small sample size, and the participants had greater verbal ability, and there was a lack of generalization of social functioning to real life. So as a practitioner of EI, it might not be appropriate to use the computer, but I can appreciate the value of playing to our population's strength. Connellan and Reed in 2016 developed a teaching procedure to help children with ASD to label emotions, and these were 10 children ages 6 to 10. These children had limited verbal ability to me and tact, no initiation without prompting, and no tacting of private events. All were receiving ABA in the home. Some were mainstream part-time in school. Others were in special ed school placements full-time. The child's regular ABA therapist taught the vocabulary to tact basic emotions, to match emotion cards to scenario cards, to generalize tacts to new scenario cards, and to tact own emotions when observing new scenario cards, all during twice daily sessions, each 20 minutes, 5 days a week. The mean number of sessions to reach mastery was 42. Baseline measures were near 0 and improved to close to 100% during teaching. Generalization was later assessed at 70 to 80%. Limitations, of course, are the small sample size, and researchers did not quantify the receptive language skills. And it would be necessary to expand these emotions from just the basics to more complex, and to extend this to natural settings. These imperfectly age-matched studies, because once again, this is 6 to 9 years old, tell us that a great deal of learning is possible. Based on the results and limitations of literature review research, in my practice, I will assess joint attention and receptive language skills first. Take into account an appropriate developmental comparison. Take baseline data to determine present levels of skill. Determine who will deliver the intervention. Identify where it will occur. Start with basic emotions and add one at a time until working up to more complex emotions, including neutral or calm. Gather materials, initially board books, emotion cards, mirror, and later videos, camera phone, situation cards, and plans to act out scenarios. Intervention options in my practice would include labeling emotions using child's books during story time, tacting emotions expressed by the child in self during play and daily living, practicing emotion recognition and joint attention when greeting a family member, using a small mirror to focus on facial expressions, practicing looking at the eyes, and full-length mirror to demonstrate gestures and posture, as well as teaching other component pieces such as tone and volume of voice in a variety of settings. Take pictures of self and family demonstrating emotions and create a laminated flipbook of feelings. Generalize emotion labeling from static to dynamic by acting out scenarios from pictures of emotions that the child chooses from the flipbook. Extend the emotion tacting to include an appropriate action. When I'm happy, I giggle. When I'm sad, I cry and ask for a hug. Thank you for watching Teaching Emotion Recognitions to Young Children in EI. And below are the references that I used.